Welcome everyone to the second session of Fresh Insights in 2026. My name is Shanice Kasura and I will be moderating this bite-sized learning session today. So, across Eastern and Southern Africa, many pregnant and parenting adolescents remain excluded from school despite growing commitments to their right to education. This Fresh Insight sessions focuses on the Right to Return brief, summarizing findings from a 2025 regional review across 21 countries on the status and implementation of school reentry policies. We will discuss gaps between policy and practice, examine barriers such as stigma, resourcing, and limited guidance, and identify actions to strengthen education systems so that adolescent mothers can return to, remain in, and complete their education. This work reflects a collective multi-sector regional effort to generate evidence that supports action, not just commitment. This was a collective regional effort across sectors and organizations such as gender, HIV, sexual reproductive health and education, and a strong UNICEF-UNESCO collaboration, bridging evidence and policy across 18 countries, regional offices, and country offices level engagements with governments, Ministry of Education and Health, and civil society partners working on supporting adolescent mothers being part of the survey. We also had rigorous academic leadership from universities of Cape Town under the Adolescent Accelerator Hub. There was also sustained commitment and support from funders, including CEDA, for this specific work through the joint UN Together for SRHR program. Now, on to the introductions. We're happy to have with us today our speakers, Alice Armstrong, who is a health specialist focusing on adolescent and HIV at the UNICEF Global Center of Excellence, and Yanga Deepa, a research assistant for the Accelerate Hub and a master's student at the University of Cape Town. I will now hand over to Alice Armstrong to take us through the first part of this presentation.
Fantastic. Thanks so much, colleagues. Good morning, good afternoon. I hope you can hear me loud and clear. Thanks for the introduction, Shanice, to this very exciting work. And I think before we move into the regional evidence and country experiences, I wanted just to take a moment to frame why supporting adolescents' mothers' return to learning remains really important for countries within Eastern and Southern Africa, and why this work sits at the intersection of rights, education, health, and development. Next slide, please. So supporting pregnant and parenting adolescents to remain in and to return to school is a fundamental rights, education, and health issue. When girls are excluded from education and learning due to pregnancy, the consequences extend beyond schooling itself. They affect well-being, future opportunities, and health outcomes, both for them and for their child. So together, UNICEF, UNESCO, and partners, we undertook this right to return work. We believe that it's not just a policy issue that is closely linked to equity, inclusion, and long-term development outcomes for young people within our region. We had a clear guiding principle that pregnancy should not be the result of exclusion from education. And when pregnancy prevention fails, exclusion from education really must not be the consequence. Next slide. So to understand why this issue requires ongoing attention and commitment from all of us, it's really important for us to consider the scale of the problem. So adolescent pregnancy remains one of the most significant drivers of girls' interruption to education in our region. In ESA, 1 in 4 girls gives birth before the age of 19, and around 6 million adolescent mothers are currently out of school. So this is not an isolated issue. This is a systemic challenge that is affecting girls, particularly those who are facing poverty, vulnerability, and limited access to services. Too many adolescent mothers never return to school after childbirth, not because they lack ambition or ability, but because the system is not fully designed to support adolescent motherhood. Next slide, please. So why does this matter? Why is school exclusion such an important topic for us? So the beyond the numbers, it's really important for us to consider the broader implications for adolescent girls themselves, their families, but also our communities. So when early motherhood is combined with school exclusion, the effects can be long-lasting. Uh, Girls who leave school early are more likely to face poorer health outcomes, reduce access to employment opportunities, and increase economic vulnerability. They also have increased vulnerability or risk of repeat pregnancy, as well as an elevated HIV acquisition risk. Children of adolescent mothers also are seen to be more likely to have poorer health outcomes, development outcomes, and this is particularly when educational and social support systems are limited and unable to support them. We do see that maternal education is strongly associated with improved child survival, nutrition, and early childhood development. Disengagement from learning is rarely a singular event. It has an accumulated outcome of when the system fails, and it does not respond to a girl's need. Unfortunately, there is an intergenerational cost. Next slide, please. So what are the factors that continue to limit a girl's ability to remain in school when she is pregnant? Evidence from across countries show that adolescent mothers are really leaving school because they're not interested. More often, they face barriers within the system that is intended to support them. Our colleagues from UCT will give us more information about this, but we do see from evidence that these barriers include stigma, discrimination within schools, and limited coordination between the various sectors, education, health, and social services that are mandated to support adolescent mothers. It's important to note that at this time, adolescent girls are navigating very complex situation. They are having competing priorities of caregiving, of their own health, their child's health, additional economic pressures that come from being pregnant and having a child. And often this happens without coordinated support from their families or services. In many cases, the responsibility of continuing their education falls heavily on the adolescent girl herself at this time that is particularly heavy for them with all the responsibilities to carry. This really highlights the importance of having a strong system, a system that supports them to continue their education, not just in policy, but also in practice. And our UCT colleagues will speak more to this in our findings. It also reminds us that returning adolescent mums to school cannot be done alone, that we require coordinated support across the various sectors. And this is essential for this to be a success. Next slide. Encouragingly, we have growing evidence of what makes a difference. We know that education remains to be one of the most effective protective investments for adolescent mothers and their children, and supporting adolescent girls to stay and return to school is associated with improved health, well-being, greater economic participation, and stronger resilience over time. Experience from many countries show that girls when they do return to school and succeed, it is because the system that is there to support them is coordinated and it is multi-sectorial. Progress has been made, and we'll hear more about this from Younger today, and many countries now have policies that recognize the right to return to school for adolescent mothers, return to learning and return to school. And our colleagues will share more details on this. But what is clear is that more work is required. More work is required from all of us, and that we need to reinforce this practical and balanced approach of, yes, preventing early and unintended pregnancies where possible, and also ensuring that the education and support needs are continued when pregnancy does occur. Next slide, please. I think that might be the last one. So, recognizing both the progress that has been made and the challenges that remained, countries and partners across the region have been working to better understand how school entry policies and policies that support ongoing learning for adolescent mums are being implemented in practice. So, that's why we undertook this work. It is to bring together the evidence, to identify some of the implementation gaps, and to support countries to strengthen the systems for adolescent mothers. And with that, I hand back to Shanice to introduce our colleague from UCT to share the findings of the regional landscape analysis. Thank you.
Thank you, Alice, for setting the scene for us. And quickly, I'd love to now hand it over to Yanga Deepa, a research assistant for the Accelerate Hub and a University of Cape Town master's student, to take us through the evidence spotlight and to just share findings of the regional policy landscape analysis of the school reentry policies. Over to you, Yanga.
Thanks, Shanice, and thanks, Alice. So we conducted online surveys across 21 countries in the Eastern and Southern African region in order to determine the current landscape of re-entry policies. So our survey questions, next slide, please, Shanice. Our survey questions focused on the presence of policies, so which countries have a re-entry policy and which don't, as well as the barriers and facilitators that countries have experienced in the development of a policy for those countries that do not have one, and in implementing a policy in those countries who reported that one already exists. In total, we received 18 responses from ministries of education, 31 from UNICEF and UNESCO, and 67 from civil society organizations. We also collected and analyzed policy documents, and I will speak about what we examined and found a bit later. Finally, this study received ethical approval from the University of Cape Town. Out of the 21 countries, next slide, please. Out of the 21 countries that participated in the study, 11 reported having a re-entry policy. As you can see from the map, the green countries are those that have a policy and the blue are those that do not have a policy. We also had an additional 2 countries reporting that they do not have a policy yet, but they are actively advocating for the rights of pregnant and parenting adolescent girls, and they are supportive of their return to school. Next slide, please. In the survey, we also asked CSOs and ministries of education about the current implementation status of their re-entry policies. We had 60% of ministries of education reporting that policies were being implemented in full, that is, in all schools, in all districts. We had 30% reporting that they were being partially implemented, which is in majority of schools, but only in select districts. And the other 10% explained that their policies had not yet been disseminated, and so they hadn't reached the implementation stage. One ministry did not respond. On the other hand, with the CSOs, we had 15% of CSOs reporting full implementation, 39% reporting partial implementation, and 46% said minimal implementation, which is only in select schools in select districts. Next slide, please. From the 11 countries that had a policy, we received 10 Ministry of Education responses. We asked these 10 respondents about the conditions that their policies have for girls to be allowed to re-enter school. 6 of the 10 responses we received answered this question. 3 countries noted that they are guided by healthcare providers or medical reports. 2 countries allow moms to return 6 months after they give birth. And 1 country shared that pregnant girls are required to leave school a month before they give birth, and they are only allowed to return 3 months postpartum. Next slide, please. All 10 countries with a policy shared that they have specific interventions in place and included in their policies. 10 countries reported that they have specific interventions in place to support pregnant and parenting adolescent girls. This includes things like psychosocial and counseling support, referrals for health services, for example, antenatal care. 9 countries reported they have interventions aimed at facilitating re-entry. So these are things such as life skills training, provision of financial and material support, for example, through external funding. 7 reported having measures that target boys and young men, and these include paternal leave provisions as well as referrals to psychosocial support and counseling. And 5 countries offer alternative pathways to provide options for developing skills and increasing employability. And these are things such as skills development opportunities, vocational training, and support with internship placement. So as I said earlier, we also collected policy documents. So we asked countries that have policies to share their policy documents with us, and we analyzed these using a framework which focused on policy content, so things such as conditions for re-entry, role players, and implementation guidelines. From this analysis, we found that conditions for re-entry varied, with some policies specifying mandatory leave and time away from school, and others being more flexible. This is also reflected in our survey responses. Several policies included provisions related to training and capacity building, and only a few policies mentioned specific actors as responsible for funding. Provisions for boys were also limited. The few we found spoke of identifying the father when a girl falls pregnant, involving male learners in counseling and support, and mandatory leave from school for the father alongside the mom. Key role players were identified in most policies, but there wasn't any specific guidance on how they are to carry out those roles. This was the same for monitoring and evaluation, where the need for it was identified, but specified targets to measure implementation were not included. For our qualitative analysis, we narrowed in on the barriers and facilitators. I'll start by discussing the common barriers countries report in terms of developing a school reentry policy. So those are the countries that reported that they do not have a policy yet. First, lack of coordination across government ministries and key partners such as CSOs and schools. Second, countries reported that a re-entry policy would not be aligned with existing legislation in their country, and this has resulted in delays to policy finalization. And third, countries reported that they do not have evidence and data to justify policy development and inform the content of the policies. As reported in Somalia, where they said that the current National Education Information System does not capture pregnant and mothering learners. Thus, the development of policy needs to be evidence-based to address the actual need for that particular area. Now, turning to what would facilitate the development of a policy. So firstly, financial and technical assistance was viewed as essential, with dedicated funding required not only for policy design, but also for infrastructure, reintegration programs, and social services. Second, countries felt that stronger advocacy efforts were needed to raise awareness of the social and economic benefit of girls' education, address misconceptions, and build support for policy development. And finally, countries reported that stakeholder engagement through coordinated partnerships across government, NGOs, and CSOs is needed, supported by community dialogue and high-level engagement with policymakers. Now, turning to countries with policies, what barriers do they face in implementing the re-entry policy? The most common barrier that countries reported are cultural and religious norms at the community, school, and household levels. These are misaligned with the school re-entry of pregnant and parenting adolescent girls. Even where there has been progress at the highest policy-making levels and re-entry policies have been developed, discriminatory attitudes and beliefs fuel stigma and resistance to permitting re-entry. One respondent in Kenya said deeply rooted cultural beliefs in some regions view teenage pregnancy as shameful, leading families to oppose the re-entry of affected girls. Second, limited policy awareness among stakeholders, including educators, school officials, families, and pregnant and parenting adolescents, which results in inconsistent implementation of re-entry policies. And third, insufficient resource allocation is another major barrier to implementation, with most schools lacking the infrastructure and support services needed to accommodate pregnant and parenting adolescents. So what facilitators encourage policy implementation? Advocacy and engagement with governments and SCOs working together to promote awareness, understanding, and acceptance of re-entry policies. Beyond supporting government efforts, CSOs play a key role in engaging schools and communities to combat discrimination and foster inclusive environments. Capacity building of officials responsible for policy rollout, including training on stigma reduction, inclusive school environment, and responding to the diverse needs of pregnant and parenting adolescents, multi-sectoral partnerships and collaborations, including linkages between schools and health facilities, coordinated efforts between government sectors, engagement with schools and communities and schools, and private sector engagement. Comprehensive academic, social, and financial support packages, including flexible learning options. So, for example, accelerated programs, evening or distance classes, and as well as measures to reduce financial barriers, including scholarships, subsidized school supplies, and conditional cash transfers. I will hand over to Alice, to Shanice, I'm sorry.
Thank you, Ganga, for just sharing with us the evidence and the spotlight. Now, we'd like to just pause here and ask you directly if you have any questions, any reflections. Please use the Q&A function to share. You can also just raise up your hand. I'll just pause here and see if anyone has any questions before we move on to the next part of this presentation. Now, I'd like to hand it back to Alice to just take us through the practical actions that we can take and the practical considerations that this brief has for us to take on. Over to you, Alice.
Great. Thanks, Shanice, and thanks, Younger, for the great presentation. So as Shanice mentioned, we're going to turn now to some of the key implementation considerations that have come from all of this work. So what does it mean for programs, and what can we all do about it? So these were key considerations were developed part of a regional steering group drawing upon the country experiences and the program learning that we gained through this analysis. They are intended to be practical, to be realistic and adaptable to different country contexts. But overall, the message is simple. Turning policy into practice requires readiness across systems and sustained action from all of us, from governments, from implementing partners, from UN agencies, from funders. What I wanted to do now is just to highlight some of the considerations, and these are available in the brief, and you can dive deeper into them and reflect more on what it might mean for you in your role and how you can contribute to ensuring adolescent mothers' right to return to learning. So for governments, the focus is on system readiness, having resources, procedures, and coordination in place so that returning to learning becomes the norm rather than the exception for adolescent mothers. And I just wanted to highlight three priorities, things that we can do to make this happen. The first is investing in the implementation capacity and resources. This means moving beyond policy statements to funded actions. So for example, allocating budget lines for re-entry, supporting childcare solutions near school, and expanding flexible learning pathways. And without predictable resources, implementation often depends on short-term projects rather than sustainable systems. Secondly is the standardizing the procedures and strengthening the dissemination. So in many contexts, the policies exist, but they're not consistently applied or understood and applied. So clear protocols, simple guidance, active dissemination to schools and communities to help to reduce the individual discretion, but to ensure that girls can return to learning quickly and also safely. The third one is strengthening coordinated and multi-sectoral support. This is something that I'm very passionate about for adolescents in general, but particularly for adolescent mothers. So re-entry works when education, health, and social protection services are linked, and having formal referral pathways and coordinated planning really helps to ensure that adolescent mothers are supported as they navigate pregnancy, return to school, return to learning, and to continue their educational journeys. Thanks, Shanice. Next slide. So for implementing partners, the focus really shifts on how policies show up on the ground. And this is around consistency, follow-up, practical support to ensure the systems function reliably for adolescent girls and their family. And just some priorities I wanted to highlight. The first being strengthening the practical implementation of the policies at school and community level. And this really includes supporting the teacher training, the school leaders, developing simple tools, checklists, working with communities. So policies are consistently applied across schools, and then there is accountability and advocacy for this. The second second is strengthening case management and sustained follow-up. So evidence-based consistent follow-up is one of the strongest enablers for successful return to learning. So this means identifying pregnant learners early, maintaining regular contact, supporting that girls return, they retain and also they complete their education. The third is providing coordinated and integrated support. So making sure that implementing partners are the ones who are best placed to link education with childcare, psychosocial support, and health services, so that girls experience the support that is a coherent package rather than having to navigate these systems alone. And the last one, and it is a key one that Younger highlighted, it is around stigma reduction and community engagement. And partners they're on the front line and they play such a huge role in shaping the attitudes within schools and communities, and working with parents, teachers, and community leaders to ensure a safe and supportive learning environment for adolescent mothers. So these considerations highlight a shared responsibility. Government can create enabling systems. Implementing partners can help those systems to work in practice. And when they are aligned, the right to return to learning becomes predictable, becomes consistent, and achievable for adolescent mothers across the region. Thanks so much. And over to you, Shanice, to hear about how we can all contribute. Thanks.
Yeah, thank you, Alice, for that. Now, we'd like to bring the focus back to you. Thinking about your role in policy, implementation, or partnership, what's one practical step you can take in the next 12 months to ensure we realize the rights of adolescent mother to return to learning? Kindly just post on the chat that one practical step you can take in the next 12 months. As you reflect, maybe we can just reflect on this one question before we move. Which country has made the most progress, in your opinion? We heard about Tanzania reversing its ban a few years back. Any other big advocacy wins? So that is directed to both Younger and Alice. The question is from Gemma. Which country has made the most progress, in your opinion? We've heard about Tanzania reversing its ban a few years back. Any other big advocacy wins? I think these are questions
Younger.
from before.
Yeah, they are. So I don't know how much time we have. We can also add these in the chat. I don't know, Younger, if you wanted to come in. And Gemma, you're right. Tanzania has reversed the ban. But I think for me, it was really encouraging to see how many countries do have specific policies, right? I was actually surprised. I thought it was going to be less. So to me, that has been a win, that in the first place, the policies are existing. And even though there's much to do with implementation, I think much progress has been made, and we are on the right track. But Younger, I don't know if you want to come in.
Yeah, I think you're right, Alice. And also just to add, it was also great to see just the alternative programs and the initiative that CSOs have made in countries. I think the work of CSOs in each country has been very important in terms of advocacy. So I wouldn't highlight one specific country that has had most progress, but I feel like with the countries with the policy, all countries are making really good efforts. And yeah, I think in the upcoming years, we might be able to see more progress, but good moves are being made on the ground, according to our survey results.
And we will be supporting this evidence to be shared at country level, and for it to spark discussion amongst key actors and partners at country level. And we hope to have updates on what countries do as a result of this work.
Excellent. Thank you, Alice. I'm seeing the practical steps are coming in. There's evidence-based advocacy for policy change. There's identifying the key methods that have the biggest reductions in stigma and ensuring resources are targeted to those methods for scale and sustainability. Wonderful. Thank you, Carol. I encourage all of us to keep using the chat and the Q&A functions to just pack all our questions there. And they will be answered even after this call ends by both Alice and Younger. And all resources will be shared from this call. Now, before we wrap up, we'd like to leave you with some helpful resources, and I've seen also the link has been posted in the chat. You'll find the brief available in Portuguese, French, and English, along with a video, a link to the video also in Portuguese, French, and English. These materials are here to support you, as Alice mentioned, and support your work moving forward. So I'll just take some time here for you to scan the QR code. You can also click on the link on the chat that has been posted for you to access the brief and the video. And with that, we'd like to end on a visual note. So here's a short video summarizing the key messages from today, and let's have a look.
Hi, my name is Thandi, and like many girls, I have dreams for my future. But sometimes life brings unexpected challenges. When I became pregnant, many thought my school days were over. But things are changing. Across Eastern and Southern Africa, more and more schools are opening their doors again for girls like me. And the support goes beyond just permission to re-enter. It gives us the tools we need to keep learning. I have learned that I am not alone. 13 countries across our region have already taken action where girls like me are being given second chances. Beyond re-entering, in some schools we get extra lessons to catch up. In others, there are evening classes or childcare, so young mothers can study while caring for their babies. Some schools even provide counseling, life skills, or financial help to make sure we don't have to give up again. And for many of us, the biggest strength comes from peer support, other young mothers who understand what we're going through. They link us to health services that keep us and our babies safe, including support to prevent HIV. These changes make it possible for us to dream about our futures once more. In some countries, girls like me are welcomed back to join the usual school routine. Imagine walking into class again and being given a desk and books. Other schools arrange catch-up lessons after hours or let young mothers join evening classes, allowing us to balance learning with caring for our children. And it's not just girls. In countries like Zambia and Malawi, young fathers are also supported with counseling, so they share responsibility and stand beside us, not against us. Communities are part of this change too. Awareness campaigns are helping parents see that girls deserve a second chance. It also helps break the stigma and build support. But lasting change happens when governments invest by developing re-entry policies, setting aside budgets, training teachers, and giving clear guidelines so every school knows how to help us succeed. Because when girls like me access their full rights to education, it doesn't just change our lives, it changes the future of our families, our communities, and our countries. Education beyond pregnancy is possible. No girl should be left behind. Hi.
Wonderful, wonderful. So thank you so much for your insightful questions and your participation and your meaningful discussion.